Today I'm down in Bristol to try a very special laser facial called Laser Genesis, and I'm here at the Quinn Clinics, which is Dr John Quinn's place, and he's going to talk me through what is so special about this treatment. It's really good for rosacea, it can help with fine lines and wrinkles, suits all skin tones, and I'm told it doesn't hurt, which is a particularly attractive part of it. So come along with me, we'll see what it's like. So John, Laser Genesis, what is it and why is it so good as a skin health treatment?
Essentially, this is first of all a wavelength that's suitable for every skin type. So 1064 is a near infrared wavelength, penetrates quite deeply, and it has a lot of medical applications. So in this situation, what Cutera have done is they've created a very short pulse duration, so it fires at 300 microseconds. And what that means is A, it doesn't hurt at all, and it fires so fast that actually it feels quite pleasant. Still has its very nice. Yeah, as a man, I don't like pain, so it definitely suits me. So in many cases, it's kind of replaced a lot of the IPL that I used to do because a lot of male patients just find IPL quite uncomfortable. So first of all, it's still a vascular laser, so it's really, really good for facial flushing, for redness, and for rosacea patients, and we treat a lot of rosacea patients here. So because of the depth of penetration, because of how it works, it goes about 1 to 2 millimeters into the skin, and it then heats the collagen and elastin in the skin, and that's what then causes skin improvement.
Okay, so scientifically that is how it's renewing and regenerating the skin.
Exactly that. So you're looking at pore reduction, you're looking at new collagen, and you're looking at skin improvement.
Okay, and this is for vascular stuff, so redness, rosacea, rather than brown pigmentation.
It may well have a role certainly as an adjunct in treating patients who have melasma. My personal feeling would be most patients that have that kind of pigmentation should be managed medically, but this is primarily, for me, a treatment that just makes your skin better. Simple as that.
Terrific. And it's quick as well, isn't it?
Yeah, so this is generally a 20 minute to half an hour treatment with no downtime, no topical anesthetic required. We often combine it with hydrofacial, so hydrofacial is a really nice treatment for prepping the skin for the laser. We call that hydrogenesis. They're quite nice as a married couple, as it were. But it's one of our most popular treatments.
And combining the hydrofacial and the laser, does that kind of have a synergistic effect, improving the effects of the laser? So
we see a lot of acne patients increasingly. And hydrofacial is excellent because I think the most valuable bit of it is the extraction element.
Okay, that's deep.
Yes, cleansing your pores. There's also like a very light peel with it as well. But I feel like it gets the skin into a really good, essentially prepping the canvas kind of a situation for the genesis. So the genesis then works better, and we get more kind of an even treatment, I think, post the hydrofacial.
Oh, okay, that's fine.
Yeah, I wasn't lying to
you. there's always a nervous moment when a treatment starts, and you think, how hot is this going to get? This is warm, this is nice.
Exactly.
Okay.
And it just warms up to a point. The device actually lets us know every 100 pulses that it's fired 100 pulses.
Okay.
And we can see that the handpiece has a kind of a traffic light system, so it lets you know that you're at the right temperature. As well as also, it lets us know on the screen what temperature your skin's at as well. So it is a bit like sitting next to a warm fire, isn't it?
Yeah.
And then you get the odd little flicky sensation, which is where we all have a couple of downy hairs. Clearly you don't have, because you're perfect. But normal humans, so you get that kind of slight sizzly sensation.
But yeah, it is just like sitting next to an electric fire, really, isn't it? Just like that bar of an electric fire.
Yeah.
And this is so quick, it really could be seen as a lunchtime treatment, isn't it?
Oh yes, 100%, yes. So as I said, it's one of our most popular treatments. On a busy day, we'll have lots of patients, particularly at lunchtime, that'll pop in and go straight back to work.
And do you need to do a whole course of treatment to see results, or will you see anything after the first one?
It's a nice treatment as a red carpet facial because the heat means your pores shrink almost immediately, so patients quite enjoy that.
Yeah.
Yeah, and because it doesn't have any downtime, lovely. But if you're going to see a long-term effect, and particularly if you have rosacea or you want to see a significant improvement in your skin quality, you're going to have 6 to 8 sessions every 2 to 4 weeks. My preference is every 4 weeks. I think, why would you rush?
For sure. So people will come in on a regular basis, sort of ongoing, to keep up the immediate glow and build on those results.
100%, and it's very popular. Once people have it done once, they generally want to come back and have it done again. So this is a treatment that I have on my day off. Because you come in, have a lovely cleanse. The treatment itself feels like, genuinely does feel like sitting next to a warm fire or warm raindrops. And that's because it's a tiny spot size on the laser and it's firing so fast you don't appreciate it as pain, you just appreciate it as heat. So what that then does is gradually build up the heat in the area. So you'll have about 8,000 shots of laser during the whole treatment, and that whole thing just takes a few minutes really. So we divide the face into various zones.
And then is it sort of zipping over it the whole time, heating it all up until you're at a certain temperature?
Exactly that. The handpiece is actually really quite cool. It's got a traffic light system, so actually the therapist knows when they've got the temperature up, so it measures the skin temperature, which is quite important. Just like you do with the radiofrequency device, you want to maintain your skin temperature but not overheat either. Okay,
so it's a warming and a building, but it's not going to be that stabbing and flickering that some machines give you.
Exactly that. So it's not a treatment that we would use for kind of individual telangiectasia on the face necessarily. But because the XLV Plus is such a great platform, we have 2 other heads on there as well.
You have a more pen-like device for those little blood vessels.
Exactly that.
Them,
exactly. And we also have a 532 nanometer that can go up to 16, 17 millimeters. So we can, if we're treating rosacea, we have lots of options. But generally, people who come in with rosacea initially are really quite red. And actually, this is the perfect option because it calms that down quite a lot and calms down the flushing quite a lot. So it's a very pleasant experience.
And the 532 is known as Green Genesis, isn't it?
The Green Genesis is something that's just been introduced on the XLV Plus platform that came in recently. So 532 is a much more superficial wavelength than the 1064, so we don't get the same level of heat that we get with the 1064. So it's not really a skin rejuvenating treatment. That's much more for patients who have facial redness and who have rosacea. But again, a lot of these patients are male patients, and as we know, Alice, we don't cope with pain very well, do we?
There have been studies. So can you combine the normal laser genesis with some 532 depending on how the patient is presenting? Would you do a normal session of the laser genesis and then perhaps the follow-up would be with the 532?
Yeah, so essentially, you've probably heard the expression shooting fish in a barrel.
How?
So when someone has a lot of chromophore, a lot of target, if they're very red, actually you want to go really easy.
Sure.
So in that situation, we would always start with the 1064 because you just don't need to really pump it up. Where the skill comes in, particularly with patients who have red faces, is when you've done the first 4 sessions. You've kind of calmed things down considerably, but they've got some problem areas. They've got some individual vessels. In that situation, that's where we might use the other hand pieces on the XLV Plus.
Okay. You mentioned how well the laser genesis works with hydrofacial.
Yes.
Are there other treatments that you have that it pairs up nicely with?
Yeah, so as I said already, we're a medical clinic. We see a lot of younger patients with acne.
Yes.
It's really hard to get to see a dermatologist these days. It's really, really hard to get onto Roaccutane these days. It's become increasingly difficult over the last number of years. So patients are now seeking other alternative methods to manage their acne. So the laser genesis, even though I said it's a vascular laser and it also affects the water in the skin, it also is absorbed by the sebaceous glands quite effectively as well. It certainly is. So it's one of the reasons why it's good for pore reduction, but also it is a really good treatment for managing active acne. And we also are lucky enough to have the latest device from Cutera, which is called Aviclear. It's a 1726 nanometer laser that primarily works on sebaceous glands. And actually we're finding that for a lot of patients who are combining them, maybe not in the same session, but that because a lot of patients who will have acne will end up with a lot of redness post their acne. And Genesis is really good for that. So they're really nice, members of the same family, I would say, in terms of how they work together.
Okay, so you'd use the Aviclear for managing the acne and then bring in the Genesis for helping the post acne redness.
100%. Okay. So post-inflammatory erythema is one of the most common things that we see. Yeah. Now, having said that, Aviclear actually seems to be really good because it's primarily absorbed by sebaceous glands, but it's also highly absorbed by water in the skin. So it seems to be good for pores and for acne scarring all on its own. Okay. But together they're a really nice combination.
I gather that laser genesis is a good treatment for a wide range of ages as well as all skin tones, because it can be good for youngsters but also for more mature people, shall we say.
Yes.
I was told it's good for 25 to 55, but let's up that to 60 because otherwise I'm not a suitable patient. Why is it good for younger patients and older patients?
Well, I think the simple fact is that for younger patients, they don't need the same level of aggression that the 50-year-olds like me need. For those younger patients, first of all, it doesn't hurt. Yeah. That's really important. Okay. It's very safe. It's safe for all skin types. It doesn't have any downtime. Like I said, it's effective on pores because it's absorbed by water. It's also effective for acne. A lot of younger patients will have, particularly for mild acne, where you don't really want to be using a retinoid because your skin's a bit sensitive, you can't tolerate it. It's great for that. Okay. If you've got a little bit of facial flushing, a little bit of facial redness, it works really, really well as well. And this whole concept of rejuvenation has become kind of more of a thing, I think, in the last number of years, because the interface between medical aesthetics and beauty therapy has kind of blurred quite a lot. So a lot of younger patients, they want to have a facial, but they want to have a facial that actually works.
It's effective.
So to me, you can, this is very much can be applied as a laser facial, no question about it.
Okay. And for the older patient, I mean, they're the ones who are more likely to have persistent rosacea that's developed over the years. Is the major benefit for the older patient going to be clearing that redness that so many of us end up with and don't quite realise it's there?
100%. So I think probably for the older patients, it would be very much part of a combination program for us. So as I said, we would start off in patients who are very red with Genesis on its own, but then actually after a couple of sessions, that's where we start to kind of move off in directions where we might add in some vascular laser more specifically. But 100%, it's very useful for older patients.
Yeah. Okay, so here's me immediately after the treatment. I mean, this is looking really nice and clear. I thought I'd be a bit pink.
Yeah, so like I said, this is a genuinely zero downtime treatment. So occasionally people will be very mildly flushed for a short while afterwards. Okay. But it does what it says on the tin.
Sure, it does indeed. And I mean, my pores looking good. Now, nobody ever really looks that closely at your pores, but for yourself, it's great to see that they've just vanished a bit.
Yeah, so one of the biggest tips I give to most of my female patients is if you own a magnifying mirror, throw it away. Because it doesn't do anybody any favours.
Yeah, Magda said she did have someone who fell asleep.
Oh yeah, all the time.
Yeah,
for sure. This is
So I think I should do a course, every month or so.
No question. And so the thing is whether you add a bit of hydrofacial in just for that little bit of extraction as well. But for me, probably the perfect facial is a combination of hydrofacial with Genesis.
Terrific. Thank you.